Major depressive disorder and transcranial direct current stimulation. What is major depressive disorder? Major depressive disorder, according to the American Psychiatric Association, can be described as a common and serious medical illness that negatively affects how you feel, think, and act. Depression causes feelings of sadness and/or a loss of interest in activities that once were enjoyed. It can lead to a range of emotional and physical problems and can decrease a person's ability to function and feel normal. In physiological terms, it is suggested that depression is a disorder related to the dysfunction in structures involved in the experience of emotions and the processing of information and stimuli. These structures include the dorsolateral and ventral prefrontal cortex, hippocampus, and amygdala. Those with major depressive disorder have observed abnormal activity in the lateral, frontal, and temporal cortices, insula, and cerebellum. In these brain regions, activity was decreased at rest and lacked activation. Studies on the brain post-mortem have observed brain volume abnormalities in major depressive disorder and revealed large volume reductions in the ventromedial prefrontal cortex, particularly in the left anterior cingulate and in the orbitofrontal cortex, as well as moderate volume reductions in the lateral prefrontal cortex, hippocampus, and striatum. It was also identified there is a reduction in glial cell density in dorsal, orbital, and prefrontal cortices and the amygdala. Most of the serotonin, noradrenaline, and dopamine neurons are located in the midbrain and brainstem nuclei and project to large areas of the entire brain. The monoamine deficiency theory suggests that the underlying pathophysiological basis of depression is the depletion in the neurotransmitters serotonin, noradrenaline, or dopamine in the central nervous system. Transcranial direct current stimulation, also known as TDCS, is gaining an increasing interest as a new treatment option for major depressive disorder, as it is a non-invasive and safe treatment option with promising success not only for the clinical symptoms of major depressive disorder, but also for the restoration of cognitive functions in other psychiatric conditions. Transcranial direct current stimulation modifies activity in specific brain regions by delivering weak direct current through two scalp electrodes with anodal and cathodal polarity. The immediate effect of anodal stimulation is the depolarization of the resting membrane potential of the stimulated neurons and thus an increase in neuronal excitability in underlying cortical regions. Even a single session of only a few minutes can lead to more enduring, lasting effects for several minutes to hours. The modern protocol of transcranial direct current stimulation is to place the anodal above the dorsolateral prefrontal cortex and the return electrode placed over the contralateral orbit, which has turned out to be the most efficient in decreasing clinical symptoms in major depression. Since transcranial direct current stimulation can modulate cortical excitability for hours after the stimulation, it was proposed that it might be a promising option for treating depression patients without the use of psychotherapeutic interventions and pharmacotherapy. Numerous neuropsychological studies have revealed that the stimulation of the dorsolateral prefrontal cortex with transcranial direct current stimulation can act in depression patients by re-establishing the balance between the left and right prefrontal cortices. Extending on the single session effect, the long-term effect of transcranial direct current stimulation on major depressive disorder patients have also been established by another study by Brioni in 2011. It was found that after 20 minutes twice daily for 5 days of transcranial direct current stimulation, depressive symptoms in all patients with major depressive disorder and bipolar depressive disorder diminished, and that the beneficial effect persisted between 1 week and 1 month. It is important to note that in other studies, transcranial direct current stimulation did not induce antidepressant effects in treatment-resistant depressed patients. However, the decreased effect demonstrated in these studies may be put down to the patient's strong psychological resistance to treatment, especially considering when the same protocol showed significant antidepressant effects in major depressive disorder patients with low treatment resistance. It would be beneficial for future study in transcranial direct current stimulation to see if it can be even more beneficial in conjunction with psychotherapy, such as cognitive behavioral therapy, to improve major depressive disorder symptoms. It would also be interesting to see if major depressive disorder due to epigenetics or environmental stresses versus hereditary depression has an impact on the effectiveness of transcranial direct current stimulation.